First of all, I'd like to ask your permission to use this video for educational purpose and on internet.
Absolutely.
Do you have any hesitation? I share your story, your information in internet with public that have a similar situation.
No,
So do you have any
glad to
hesitation?
help. Glad to help others.
Yeah. Tell me, how did you find me?
I had a open surgery scheduled, and I was looking at what to expect after surgery, and I found you talking, doing an interview with Bob and Brad, and I liked what I heard about the minimally invasive, and I had been looking for in Oregon for a surgeon that would do that, and they told me, no, we can't do that in your situation.
Yeah. What did you hear about your surgery or recovery that you were scheduled to get in Oregon? Because you told me you were scheduled to get that surgery, right?
Yes.
Tell me about it. What were you expecting from that surgery?
I was expecting 6 months to a year before I would be able to function well.
Yeah.
So, and I was going to be in a lot of pain.
Yeah. What did they tell you about the surgery itself, or what did they tell you about the recovery otherwise, hospital stay and so on? What did you hear about that?
The hospital stay was going to be, I think, a week.
A week, yeah.
And in the recovery, I was going to have to wear a back brace for 4 months, and wouldn't be able to drive for, I forget the length of time, but quite a while.
Okay.
And yes.
Well, we have a good track record that our patient usually stay after you got a 3-level fusion. But even with that, we have a good track record. Our patients stay overnight, only just over the night in the hospital. The most important thing here is that we didn't have to cut the muscle and the bone to open up the nerves and remove the pressure from the nerve. You had some leg symptoms before the surgery, correct? Describe them to me.
Yes, I couldn't stand long enough to take a shower. I had a stool in the kitchen so I could put it in front of the stove and sit down
so you
to
had
make
leg
breakfast.
Pain?
Yeah, my feet and legs would go numb, and
and you
feared falling.
Yeah, and you said as well some burning, maybe?
Yes, burning sensation in my thighs. Which my right thigh was pretty severe. The left one kind of came and went, but
How long did you have that?
It started in my right leg, and I probably had that starting about 3 years ago, and I had neuropathy 5 years ago, and it just progressed.
It just got worse and worse.
Yes, and it got to the
1
point I
to
couldn't
10,
walk.
what number would you give that pain in your legs?
If I had a busy day and I pushed too hard, I would get probably an 8.
8?
Yeah.
How is that leg pain now?
It's gone.
You woke up and it was gone?
Yes, I was. Yes, I was amazed.
Yeah.
And grateful.
Yeah, and your surgery was about 1 hour and 15 minutes, less than 1 hour and 15 minutes. We lost 66 cc of blood, even I think about 2 ounces or 1/5 of a cup of coffee. And I think the surgery just was few hours ago.
Yes.
So and people who have done what I do with doing 3-level fusion know that people after this kind of surgery don't look like you. They are much more miserable after that kind of surgery. But so you woke up, leg pain is gone, that you had it for years, and the next plan is getting you out of bed. I think you just came here just a few hours ago, but the plan is tonight getting you out of bed.
Okay.
What the question?
That's one of the things that impressed me. Like I said, I found your videos on YouTube and watched most of them, and I was impressed about not cutting the muscle. That was because, like I said, we bought a little hobby ranch, and I want to be able to pursue that.
Yes, that's a goal. That's a goal, and we have a track record that we can put people back on their life fastest than any other surgery.
Yes, and that's what I wanted, and I said, the other way, I was going to lose muscle.
Yeah.
And,
did the material that we put on the internet, did they help you?
Absolutely. Like I said, I would have, if I didn't find that, I was looking to see how long it would take me to recover, and like I said, we're talking 6-8 months before I could do much of anything. So, that just impressed me, and that's why I gave you a call and got the ball rolling.
I'm happy you did. So you flew all the way from Oregon to Crookston, Minnesota,
Yes.
to get your surgery done.
Yes, some people think I'm crazy, but like I said, I know the medical field kind of takes a little time to change their ways.
Yeah.
And
I
I was impressed with what you're doing.
And I'm thankful that you did that. Medical field changed slowly
Yes.
because until now, for the patient, it was hard to get medical information,
It is.
but
It
not
is.
anymore.
Yes.
As you can see,
Yes.
this is exactly the reason we are doing this. You know, I'm like most of my colleagues, very busy, but I do take my time to create this kind of conversations.
Yeah, and then it's. I'm glad I sat down to find out how long my recovery was going to take, because now it's going to take much less.
Much less. And you have a good track record of
Yes.
that. Okay.
Yes.
Well, thank you so much for the interview. I appreciate it.